Hey everybody, it's Brittany here, and today I will be going over the current ACSM pre-participation screening. In this video, I will address the algorithm components, measuring and gauging exercise intensity, as well as some of the signs and symptoms of some known cardiovascular and metabolic diseases. So what is the purpose of a screening? It is necessary to identify and address those at risk for cardiovascular events, either during or after exercises. The new algorithm allows the unnecessary boundaries built from the previous health stratification module to be less intense. This is really important because it could actually impact the ultimate decision of somebody who is wanting to begin a workout. So now we'll talk about the actual algorithm. And this is for the clients that do not currently participate in regular exercise. So if we look to the left, this is if the client has no cardiovascular, metabolic, or renal disease and has no signs or symptoms which are suggestive of these diseases. For this population, medical clearance is not necessary, and they may also progress onto light and moderate intensity exercises. If the client has a known cardiovascular, metabolic, or renal disease and are asymptomatic, it is recommended to get medical clearance. And this is just simply because when you are sedentary, it puts you at a higher risk factor for some of these adverse risk events happening. So following medical clearance, it is okay to progress onto light to moderate intensity. If the client has any signs or symptoms which are suggestive of a cardiovascular, metabolic, or renal disease, regardless of whether or not it is a diagnosed disease status, they should get medical clearance. And following the medical clearance, they should be able to progress onto a light to moderate intensity exercise recommendation. And of course, they may gradually progress as tolerated by the ACSM guidelines. Within the populations or clients that do participate in regular exercise, if they do not have a cardiovascular, metabolic, or renal disease and have no signs or symptoms, medical clearance is not necessary, and they may also continue on to moderate or vigorous intensity exercise programs. If the patient or client has a known cardiovascular, metabolic, or renal disease and is asymptomatic, then medical clearance for moderate exercise or a moderate intensity exercise is not necessary, but it is necessary to have medical clearance within the past 12 months. After this, they should be able to continue on to moderate to intense exercise intensities, of course, following a medical clearance. And if they participate in regular exercise and they also have any signs or symptoms suggestive of a cardiovascular, metabolic, or renal disease, regardless of the disease status, they should discontinue the exercise and seek medical clearance. After this, they may return to exercise following the medical clearance and gradually progress as tolerated by the following ACSM guidelines. Some important points to go over are whether or not your client is physically active. So, does this person participate in exercise of moderate to vigorous activity 120 to 150 minutes per week collectively within the last 3 months? It's also important to gauge whether or not the participant is physically active. This is simply because their body needs time to adjust to the new stress that you could be doing, and it should be a slow progression. So this makes sedentary at more risk, especially if their intensity goals are set higher. Does the patient have any known diseases like a cardiovascular, renal, or metabolic disease, or any symptoms suggestive of it? Having a disease or being symptomatic can increase the chances of having a cardiac event during or after exercises. So, how do you gauge intensity, and why is it important? Well, it's important for knowing the initial physical activity levels for your clients and also in determining the desired intensity goals of your client. Next, you'll need to know what your client's desired exercise intensity is. So this is important because we need to make sure that their desired intensity for the patient is appropriate for what their current state allows. For example, if a past marathon runner had intentions of resuming competitive races but has been sedentary for a year after a cardiac event, they would need to progressively grow to the desired intensity instead of beginning vigorously. The reason for not doing this, of course, is it could potentially cause a cardiac event within this client. So a slow progression from low to moderate and then to vigorous is always recommended. Some signs and symptoms indicative of a cardiovascular disease are pain and discomfort in the chest, neck, jaw, arms, or any other areas that may result from an ischemia. So a lot of these signs and symptoms right here are the same for a heart attack or cardiac event, such as a myocardial infarction. Dizziness and syncope, shortness of breath at rest or with exertion, ankle edema, which could be caused by venous insufficiency, palpitations or tachycardia, intermittent claudication, a known heart murmur, unusual fatigue or shortness of breath, orthopnea or nocturnal dyspnea. In conclusion, the pre-participation algorithm is meant to reduce unnecessary boundaries in the populations which are seeking a healthier lifestyle. Some important points to keep in mind are if a person is symptomatic, they must seek medical clearance first before continuing with any exercise prescriptions. And remember, if an individual does have a disease and they are sedentary, they should seek medical clearance first. This is just mainly because being sedentary really puts the client at a more adverse risk for some of these events happening. Thanks for watching.